And I'm going to come under the back.
Look how he's just staring at Diane.
I know.
See,
It's really
so
alert
that we
these
can-
days. This is Susan Yara.
And this is Sharzad Kiade.
Some call this the Sharzad and Susan Show.
Or the Susan and Sharzad Show.
We just call it
The SASS. Sharzad,
Yes, Susan.
what comes to mind when I say craniosacral therapy?
I don't know. Something with the brain, maybe?
Yeah, so to be fair, I had no idea what it meant either until I actually had a treatment done. So you guys all know, I'm pregnant still. Somewhere in like the second trimester, I start to feel some pain in my back, and it's because this little guy has decided to move over to only one side of my belly. And so I was getting a massage, a prenatal massage, and the masseuse recommended that I see a woman named Diane Black. She is here in Santa Monica, that's where we're at today. We're gonna see her because she is an acupuncturist, but so much more.
Yes.
She offers this treatment, and it's basically manual therapy.
It's really cool because she can work on people that obviously are pregnant, post-preggy, and little babies. So baby Cyrus is here today and he's getting his very first treatment. He's co-hosting this house with us. Are you guys ready to see this? Let's go.
Diane, I'm so excited. Last time I came to see you, I went home and I basically told Sharzad, I was like, you have to see Diane.
Oh,
And
that
I'm
makes
so
me
happy that we're here. So can you explain what you do and what you're all about?
Sure.
I know there's a lot to you, and
One sentence.
So I'm a licensed acupuncturist. So my job as an acupuncturist, through our evaluation techniques, taking the pulse and looking at your tongue, listening to your story, examining your body, sometimes palpating, is to determine where I need to place the acupuncture needles so that I give information to the chi flow in your body. The energy gets harmonized and your body goes, oh, I can do that.
Right.
So it's not me doing it to you or for you exactly, but it's using my skill set to re-educate your body.
But you do something in addition to acupuncture. You do craniosacral therapy,
I
right?
do many manual therapy
Okay.
modalities, craniosacral therapy, visceral manipulation, neural manipulation, and the Lowen system of dynamic manual interface. And I don't do any cracking. I'm not a chiropractor.
Right.
But it's very gentle manual therapy that, just like the Chinese medicine, respectfully listens to what's going on in the body, and by making gentle suggestions and gentle movements, the body then does its own correction.
So take us through kind of the different processes. So how is it different for someone like me who is pregnant?
It's one of the things I love doing, is
Yeah.
helping a couple,
Conceive.
and then taking someone through a pregnancy. And sometimes things come up. Morning sickness, as you know, is really common. A lot of women have to change their diets when they're pregnant. And then as the body changes and shifts, you mentioned relaxin earlier, and the stresses of the pregnancy, there is often structural stuff, low back pain or hip pain. Sometimes the way the baby is positioned, it's pressing on a nerve. So those are all things that we can address.
In my example, for instance, I came to you because my pelvis,
Yes.
because the baby just wants to hang out on one side, was feeling like it was really sore. My back was actually starting to become sore on one side. So in that circumstance, what do you do on me?
So always acupuncture, because for me, this is, I think this is my baby, these almost 30 years now, that taking the combination of the Chinese medicine and then enhancing it with the osteopathic, with the manual therapy, the gentle manual therapy. So that's why in the beginning of my treatment, I do this technique, which I didn't invent. It comes from Dr. Baral, called general listening. And I will have the patient stand in as neutral a position as possible, and I'll put my hand on top of their head very lightly, and just a very gentle touch on their back. And then I'm literally with my hand asking the body to say, where is your problem? All right, we can take care of that sacrum. So if you would lift just a little bit for me, that's enough. I'm just going to slide one hand there and one hand here, and let your body weight really settle onto my hands. Close your eyes. I think it's more relaxing. And you can feel how your sacrum is settling. There you go. So now I'm going to go very specifically to your sacroiliac joint. Right there. Yes. And I'm going to lift your leg up onto my knee. Is that comfortable? Okay, and tell me which one is more tender on your foot. Is it this one or this one?
That one.
That one. Okay, so really let your leg hang onto me. Can you feel the connection between the 2 points?
Mm-hmm. It almost feels like it's sore.
Well, we call this stacking the fascia using a long lever. So rather than trying to just get your sacroiliac joint to relax with one hand, I'm collecting all of the fascia of the whole leg, and I'm focusing right at that point. And as one of my teachers likes to say, you give the body an offer it can't refuse. And then it lets go.
Ooh, he's moving.
Yeah, I can feel him. He likes it too. It's giving him a little more room. There you go. Nice. That was good. I'm gonna just move him off of you a little bit. And then I'm gonna work with your foot again. There. That was nice. Can you feel that?
Oh yeah, I feel that.
Yeah.
That's so funny.
It's, and I'm not using any pressure. Feel that? This is going to help your sleep. So that line of tension that's coming all the way down here goes all the way into here.
Ooh, yeah, I feel that.
So the nice thing is that I can just get it to release from here. I don't have to work on your whole body. And this is actually a neural manipulation technique. That is a nerve that I'm on. So you can see I'm using very little pressure. There it goes. So is that better? See?
I was so surprised by how light your touch is. Because you're expecting, I guess you are thinking kind of like a chiropractor.
Where you
or
get your
something
neck
like
like
that.
popped
you're
and
like,
you hear all these crack sounds.
like that kind of thing. And it kind of scares you, right?
Right.
When you do that. But in your treatment, it feels it's so different. You just kind of are, what are you pressing on?
I'm not using pressure. I'm using the body's own fluid flows, for example. We all have blood flowing in all directions, and there are many, many different patterns of that flow. Using the movement of the blood flow, for example, is a really, really gentle way to get tissues to release.
Like for me, I don't really have any major issues other than I'm exhausted, which is normal, and I feel a little bit bloated. But you can kind of take a look at my body and see maybe if there's something else that's going on that's causing one thing, and you can just customize a treatment for me, right?
Can you feel when I go this way it glides, and when I go this way it hits a barrier? Can you feel that?
A little bit, yeah.
So that's why I feel like even though you carry the baby that way, I think the issue is here.
Okay.
So I'm going to just work with that.
Please.
As we walk and move around, the bones move in a very specific way in relation to each other. And so some of the osteopathic work that I do, the manual therapy, is getting the bones to move harmoniously the way they should.
Okay.
So that's what I'm doing.
Oh,
right
cool.
now. And I think in your case, the issue's actually here in your foot, not in your hip.
Okay.
Is that a little tender right there?
I mean, it feels really good. I don't know, it doesn't hurt or anything.
There it goes.
Oh, wow.
There.
Cool.
Okay, so now I'm gonna come under here.
Magic hands.
There we go.
Oh.
Can you feel that?
Yeah, I can.
Yeah. And so if I come back here, feel how much different that
Yeah.
is? It's like a nice easy glide.
Yeah.
Yeah.
Cool.
You have a little digestive something going on.
I do. I don't know what. I'm so happy that you brought that up.
That's
I feel
my
like
job,
bloated
right?
and
Like right in here, there's some
Yeah.
tenderness. So this is part of the visceral manipulation work.
Okay.
Visceral meaning the internal organs. And it's really gentle. You'll see when I do it on the baby.
Okay.
There it goes. I picked up that you had some digestive stuff, and I worked on your stomach, and then I found that it was really connected to your diaphragm, which makes me think that you hold your breath a lot more than you know.
Oh, interesting.
Yeah, that there was a lot of tension around your diaphragm that was affecting your stomach.
Okay.
Okay. But also I would probably question you about your diet.
Okay.
And try to specify which are the things that might be irritating your digestive system and causing inflammation.
Until I had spoken with you and had a treatment with you, I had no idea that babies could be treated. So what would you do with this guy?
And
can we see?
Yeah, he's also bloated as well.
So I always like to just create more harmony. Okay, I'm gonna lift your legs and just move this up a little
that's
bit.
nice.
Is that good?
Yeah.
Look at that belly. We love the belly. Your face is so adorable, so expressive.
I know.
Okay, so again, on his belly, I'm just gonna feel just like I did on you. I'm just gonna feel his organs, and you felt how light the pressure is.
Yeah,
I'm not pressing at all. I'm listening. You know, that's the osteopathic work is really. It's like my hands are listening. It's sort of like you see with your heart and you listen with your hands. He's a little bit stuck right in here.
Yeah, he's a little bloated, and you can see his belly button's kind of sticking out, especially right now he's pushing.
We can just feel the place in the spine, because all the nerves for the viscera come primarily from the spine, just like for everything else. Oh, yeah. There you go.
Thanks, Diane.
Can you see the difference? I mean, it's still pushed out, but in here it's much softer. You see, it's a little bit softer.
Yeah.
Okay, I'm gonna just take your legs up like this to give me a little more slack. And now I'm working on his intestines. Again, it's just really, my hands are really soft, and I'm following his natural movement. And feeling for if there are some restrictions, and there's a little tiny restriction right here. A restriction is just like a tight muscle.
Bless you!
Oh, bless you! One more.
Bless you!
A restriction is an internal version of a tight muscle. We all have them, even little tiny babies. And see, that's all it took, and now it's much softer.
He does look less puffy, like, because I see him from this angle more,
Sure.
so he does look less puffy. Are you less puffy?
Oh, there we go.
Oh, freedom!
Oh.
Freedom.
Now I'm going to do the similar thing with his shoulders that I did with his hips, just to check the range of motion. Can we just do this?
Yeah.
Can we do that? And that? Oh! Now, this arm does not want to move up as easily. I don't know if you can see that.
Yeah, I can.
Yeah, so it's not much. It's probably something that would fix itself, but why not give him a little extra?
Yeah. So he's getting ready to give you a nice smile.
Okay.
Oh.
There. See, now they're more even. Can you see that?
Yeah.
Oh.
How cool is that? So now what I'm going to do is I'm going to pick you up and turn you around so your head is closer to me. Is that okay? So this is the cranial part of the craniosacral therapy. And it's, again, very light touch. And I'm just feeling for the movement of the bones. The bones are very soft and very mobile.
He is so alert, my baby.
Yeah, you are making a connection, aren't you? Almost done. I'm just going to put one hand on his occiput and one hand on his sacrum, and there's the craniosacral. But in this case, I'm just making sure that there's a nice even flow of energy all the way through his spine. So, present. That was a big present. I'm going to bring you a little closer to me there. Okay. And so I'm feeling his sacrum, which we examined before and moved beautifully, and feeling his occiput, and then just making sure that there's a connection, because of course, what is that connection? That's like the central nervous system.
I think it's so interesting, and he obviously is enjoying it.
Yeah, that's how we treat babies.
Awesome. I mean, he says thank you. Yeah.
But I do have to kiss your belly one more time.
What'd you think of your first
Oh my
experience?
God, I loved it, and I love that it was truly such a gentle touch, and I felt like just like my posture was better, and seriously, within seconds, and I'm not making this up, my stomach felt less bloated.
Yeah.
Cyrus has been a little bit bloated too. His stomach was super puffy, and I was so impressed that it just like almost went down immediately.
I know.
Yeah, that was
You
crazy.
could see it, like it was moving. Like
Yeah.
it looked like it was kind of just like a belly, and then it started to just kind of look like it was a loose belly.
I mean, he's had a Buddha belly for a while, and so I'm really trying to pay attention to what I'm eating since I'm nursing him 24/7. He did let out some gas, and I'm sure that felt so good for him.
It
Just like,
probably did.
thanks, Diane.
At first you're like, is she doing anything?
Yeah.
Is this doing anything? And then and she's kind of like, relax. And you think you're relaxing, and then suddenly you just feel like something just really does relax. It's so funny.
He loved it, obviously. He's like really chill mode right now, so it was great.
Diane is based in Santa Monica, California. She practices all types of Eastern medicine.
And if you are wondering how much she costs, it's $185 for the first session, and that's usually gonna be about an hour and a half, an hour and 45 minutes.
My first session was basically 2 hours.
Yeah.
I came in here, she wanted to talk to me first. She really kind of like wanted to address all the questions that I had and everything, because I had no idea what I was in for.
Right.
It's really peaceful here.
Really good vibes, yeah. And then
really good vibes.
any follow-up appointments are $160, and a lot of times your insurance will cover it. Like your insurance is covering
Yeah, my
this
insurance
too.
covers this. And just so you know, she told us she's gonna be 71 years old, which we did not believe.
Yeah.
And what was her reaction?
Yeah,
when
it
you
was
said
so cute. When she told me, I was like, what? And she dances, she goes, Chinese medicine. I was like, yeah, girl, get it. Big thank you to Diane. Cyrus says thank you too. And we're really excited we're not bloated right now. And yeah, thank you guys so much for watching. As always, you can leave any suggestions for things you want us to do in the comments below. Subscribe, we're so close to 200. Woohoo! So awesome. Thanks again for watching, and we'll see you next time.
Bye.
Bye. Bye-bye.